Hi, my name is Tammy, and I'm a senior independent beauty consultant for Mary Kay. Today, we're going to talk about skin. We're going to go over some basic anatomy. We're going to talk about how our skin ages, and we'll talk a little bit about cleansing our skin. This webinar is for friends, family, coworkers, colleagues, even consultants, anybody who wants to know more about their skin and why they use certain products and the rationale. So share this with as many people as you'd like. So let's get started. Let's first talk about some basic anatomy of the skin. I've drawn a real rudimentary drawing here that shows different layers of the skin. We're going to start with the epidermal layer, which is on the very top. Our skin is the largest organ in the body, and it has over 60% water. It insulates us, it protects us, and so in knowing more about the different layers of the skin is very vitally important. So the epidermal layer is the most outer layer. That's generally where a lot of skincare products focus their attention. The top layer of the epidermis actually has multiple stratums on it. And the very top stratum has dead cells on it. It's about 25 layers of dead cells. So these cells are not live at all. They just sit on the top. And so a lot of exfoliating type products are focused on removing those dead cells. And we'll talk about that a little bit more here in a minute. Also in the epidermis are live cells. That's at the very bottom layer of the epidural layer. And those live cells are called stem cells. So if you're ever buying products and you look for stem cells, they're probably plant-based stem cells. The idea behind that is they're focusing on that epidural layer of those cell regeneration and cell turnover. Now, you or somebody you may know have gone and gotten a very deep facial before. And some of these are done in a dermatologist office, and it literally scrapes the first epidural layer off of your skin. The idea is to create an environment where those new cells are regenerating. So that's what that's all about. Let's next go to the dermal layer, the dermis, which is the middle one here. This one has some really important properties to it. First, it's got more blood flow, more vascularization. But the second thing that's really important for you to know is this is where collagen and elastin are kept. Now, collagen is what gives your skin tone and strength. And we lose about 1% of collagen every year of life. So proteins and products that have collagen boosting in them are focused their attention right on that. They help support the collagen you already have. They probably have peptides or amino acids in them. We also have elastin in the dermal layer. And elastin is kind of like a rubber band. It helps create shape. It brings back the elasticity. We also have elastin in our heart valves and other blood vessels and even our liver to help it bounce back and be elastic. Now again, as we age, elastin diminishes. But some things we can do to help that are eating right, high protein, getting good sleep and hydration. Wearing sunscreen is a key one. Using moisturizers with A, C, and E, and also quitting smoking all help with elastin. So now as we get older and the collagen and elastin are diminishing, what happens is gravity. Gravity starts pulling on our skin, pulling it down. It gets saggy. And that's where your lifting serums come into play. A lot of your lifting serums are focused on that collagen and elastin and helping create that tone again, okay? So that's what that's all about. Now, some people may go to that next level and go and get dermal fillers. And that's actually truly an injection with a needle underneath the epidermal layer into the dermis to create plumpness in there, and you inject different ingredients. We will not be talking about dermal fillers here today. Finally, we have the hypodermis way at the bottom, and that has fat mostly in it, and it creates insulation for your body. One more thing I want to talk about are pores. Now, pores go almost all the way down to the hypodermis. They have either oil or or sweat in them, and the hair follicle is in there. Now, the reason why I'm telling you about pores is as we get older, those pores kind of get bigger, and that's because we're losing collagen and elastin. So here's what's going to happen. Your pores are going to get bigger as you get older. And remember all those dead cells on the top layer of the epidermis? Well, they're all just going to sit there in those little divots. And so you're going to get dull, lifeless skin, and that's where exfoliation comes in. This is why I just did a facial for somebody, and they were probably in their 80s, and they still were getting pimples now and then. It's because the pores are still getting plugged because gentle exfoliation is not happening. So just wanted you to know about pores a little bit. So now let's talk a little bit about washing our face. I can't tell you how many women I've talked to that just use plain water to wash their face. I'm going to give you 4 reasons why you don't want to use water, okay? First one, to wash off bacteria, makeup, all of that. Sometimes water just doesn't cut it. Secondly, you need to normalize pH levels, okay? Especially if you have problem skin. Either it's too dry or you have acne. Water isn't going to cut it because that pH isn't the same as your skin, okay? You want a pH balance cleanser. Third, you'd like to provide gentle exfoliation, and there's a lot of products that we have where when you're doing the cleansing also has little beads in them to create exfoliation. And then finally, if you're like me, I like scalding hot water, but the problem with that is it pulls away all the essential oils in your skin. So you need to replace that if you're going to use really hot water. I want you to think a little bit more about your water at home. Do you use a water softener? Do you have hard water stains on all your fixtures? Do you have a lot of iron in your water? Do you really want just that on your skin? And that's why you need to use a cleanser. Dermatologists recommend washing your face twice a day. If you can't quite get twice a day, at least do once at night. All right, well, that's all for today. Thank you for tuning in. Please leave a comment. Tell me what you liked, what you learned. That'll give you credit. Remember, if you watch 4 out of the 7 videos, I was hoping you'd watch all 7, but if you can only get to 4, that's fine. And you make a comment, you will be entered into a drawing for a full-size C&E serum at the end of the series. Have a great day, and I hope you log in the next time. Our next topic will be on resveratrol. You don't want to miss it. Have a great day.